If we have a payments tax instead of income tax, and we were taking 0.2% out of the 5,000 trillion payments that occur each year in our economy, we'd have a sufficient amount of revenue coming in that we could have free health care for every citizen in our country. Our country's biggest challenge today in health care is that it costs about $10,000 per capita. If you look at the 4 top healthcare systems in the world today, which would be Israel, Singapore, Hong Kong, and South Korea, they all have very similar cost of living as we do in the United States. But they're accomplishing what we're accomplishing at about 1/4 to 1/3 the cost. So what's the problem in our healthcare system? The problem is the incentives are all completely reversed. If you look at how a doctor is paid, he is paid per procedure. He is incentivized to do as much as possible in order for him to make a living. The insurance company's job, or Medicare's job, is tell the doctor to do less and to reduce the pay on that. So the doctor and the providers, the pharmaceutical companies and the medical supply people are always going to be pushing for more and more tests, while the payer is going to be trying to put the lid on that. And who loses in that? The consumer. And the doctor doesn't make out that well either. There's a much easier way to do this, actually. And we have all the actuarial data for this already through the millions of people who are on Medicaid. We know how much it costs today to take care of a 30-year-old male or a 70-year-old woman or an 18-year-old female. And so a simple table is established saying, if you're this age and you're this gender, this much money follows you. That's your money to spend on health care. And the way you would set it up is you would let the doctors, the providers of health care, set up systems, a little like Kaiser is today. And when you would join, they would get that much money each month to keep you healthy. Now, if you weren't happy with the care, you go to another provider group. But your provider now has an entirely different mentality. He's got the top line and he has to control the bottom line. And so he works to reduce the cost. I'll give you a very concrete example. Pedicle screws that are used in spine surgery. They used to cost about $1,600 per screw. Now you can manufacture them for less than $1. But if the medical device guy comes in and he says it's $1,600 a screw, the surgeon's going to say, you know, I think I'll start a company here and manufacture them for $1. So the system is self-correcting. So the only rules that you need to have are allow the doctors to own their own practices, put them back in charge, allow the consumer to choose which doctor they go to, and give them the right to go to anyone they want. That becomes the formula for free health care in the United States and quality health care at the same time.